Okay, I'm gonna get started. Hi everyone, my name is Elizabeth Balarinwa. I'm a junior clinical laboratory science major on a pre-med track at Howard University, and I am a community communications and developments fellow at GlobeMed. And welcome to the fourth installment of GlobeMed's Health Equity Speaker Series. Um, Today, we'll be discussing the art and the action of lobbying, policy change, and young leaders in public health with two friends of GlobeMed. This topic is really important to me because it's something that I think I'm kind of bad at and I think is kind of hard for beginners to understand. So I'm really excited to see what we can all gain from this. I'll first start by introducing Giovanni. Giovanni was a member of GlobeMed at Northwestern University, which is the founding chapter of this organization. He's held leadership roles such as director of fundraising and campaigns for his chapter and is currently a Fulbright Fellow. We at GlobeMed headquarters are so honored to welcome Giovanni back with the director of the Illinois chapter of Fund for Global Health, Keith Johnson. Keith Johnson has been the director of advocacy at Fund for Global Health for 8 years. He has had prior experience with lobbying through 15 years with results, the citizens lobby dedicated to ending hunger and poverty. He was a volunteer group leader and regional coordinator in Results, then an organizer on staff for several years. So once again, we are so happy to welcome you all tonight, and we can jump right in. Just a reminder, there's the YouTube link for streaming in the chat, so you can share with your friends. Hi, Giovanni and Keith.
Hi, Liz. Thanks for the introduction.
No problem. Do you guys want to give a little short introduction, or do you just want to jump into the questions?
I'm ready to jump. Yeah, I mean, thanks for a great introduction, Liz. As Liz said, I was at Northwestern and I started GlobeMed. I joined GlobeMed my freshman year, my first year, and I graduated in the spring of 2020. I see Najma here. She was one of our members in GlobeMed as well. Hi, Najma. But since then, I'm taking a few gap years before med school, and I've been working with the Fund for Global Health for the past few months now, as Liz said. Thank y'all. Hi, everyone.
Okay, so let's get started. So our first question is about the journey that led you to the Fund for Global Health and your passion for health equity. So if you could please tell us a little bit about that.
Sure. My story starts quite a while ago in the 80s. I was a member of the Hunger Project, which is where I made a commitment to do something to end hunger, but I wasn't sure what. And then some of my friends invited me to a Results meeting in Seattle. They hosted in their living room. The founder of Results, Sam Harris, came to Seattle, and it was really quite a breakthrough evening for me. We learned that at that time, according to UNICEF, 40,000 children were dying every day of preventable causes. And we learned about one of the things that a very low cost solution that could be addressed at this, oral rehydration therapy, which is, and I remember this, did the visuals, 8 teaspoons of sugar, 1 teaspoon of salt in a liter of boiled and cooled water given to the child that has diarrhea, enables them to absorb liquids again and prevents diarrheal dehydration, which is one of the biggest killers of children. Very simple solution. We learned that UNICEF was implementing this and that we should be working on more money for UNICEF so they could do more of this. Sam said then, now you know more than your congressperson does about this, which was a great realization, because that means, hey, I could tell them something that could make a difference. And so Sam, at the end of the meeting, the purpose was to start a results group in Seattle. And so I said, we need at least 4 partners and we need a group leader. We can't have a group without that. So 5 of us raised our hands, and everybody else was quick to say, I'm in, but I don't want to be the group leader. So I was just slow enough to be the last person to respond. And I thought, this is too important. This has to happen. So I'll be the group leader. And it turned out to be a transformative experience for me. We went on to lead monthly letter writing meetings, to meet with our members of Congress and their staffs. And I was actually inspired to start other results groups around the region. And I went ahead and did that and lobbied Sam to hire me as an organizer, which finally happened. Results was instrumental in, among other things, starting the Child Survival Fund, which started at $50 million a year through our citizen lobbying. And it's grown over the years since to about $850 million in an account called Maternal and Child Health, which is now one of the main focuses of the U.S. Agency for International Development. How this led to Fund for Global Health is Ernie Lovinson is a director, executive director of Fund for Global Health. And Ernie was a board member. I was a grassroots member of the board. I heard Ernie speak at board meetings, and I was just very impressed with his kind of wisdom on what needs to be done to end hunger and poverty. And later on, much later, actually in 2013, I found quite by accident that Ernie had moved to Seattle. And he had moved out here to work for the Gates Foundation, and then had started up this thing called Fund for Global Health. And so I said, whatever you're doing, I want to be part of it. So I'm happy to volunteer doing whatever you need. And it just evolved, and we moved into congressional advocacy in Fund for Global Health, which is kind of our common background with results and seeing the difference that citizens can make in influencing governmental policy. So that's basically how I got here.
Giovanni, thank you for sharing.
Yeah. Keith has a more diverse, in-depth background than I do for sure. But I was born in the Philippines. Growing up in the Philippines, there's a lot of health disparities that I kind of encountered. One of the biggest things that I wrote about when applying for the Fund for Global Health was my encounter with tuberculosis, which is kind of ubiquitous in the Philippines. And that experience and my upbringing in the Philippines and when I immigrated to America kind of also ignited my passion for not just healthcare, but my motivation to become a physician. And that boosted me throughout college, through high school, throughout college. And then when I was thinking of doing my gap year, I kind of wanted to join a nonprofit that would provide me a good background in kind of health policy or like lobbying. And I found the Fund for Global Health through the Global Health Department at Northwestern. They talked about the Fund for Global Health in one of the listservs. And I thought it was a great opportunity for me to learn more about kind of how can I, as a citizen, use my voice, use my vote to kind of reach out to senators who make up the money, the budget to aid a lot of the global health programs worldwide that affect things like tuberculosis, AIDS, HIV, poverty, like Keith has talked about. And that's kind of how it led to my role now in the fund. I'm currently working with the Illinois team in the Fund for Global Health, working closely with Senator Durbin, which is in who is in the SFOPS committee, which is the committee that Keith will talk, I'm sure, later on about the SFOPS committee. They provide the funding for global health programs annually. So that's kind of my background in the Philippines, led me to, again, my passion for medicine and healthcare equity. And through that led me to the Fund for Global Health now that I'm in my gap year before I go to med school.
Okay, thank you. Our next question is just a little overview about your experience in lobbying. I'd also want to know, for both of you, what stuck out about lobbying?
Well, I thought I would tell a story, my first experience in lobbying, which is kind of a funny story. Back in Results, we had our first national conference in 1984. We met in a church basement over the weekend, and then we had set up appointments for Monday to go out and visit our members of Congress in their offices. And there were three of us from Washington State there, and we had an appointment in Senator Gorton's office. Senator Gorton was a Republican from our state at the time. And so we were meeting with the staff, and lo and behold, the senator walks in, completely unexpected, was not planned to join the meeting. And I did something completely inappropriate. I just yelled, I was so surprised, I said, "Hi, Slade," which is not the way you address your senator, especially the first time. So it was, but I was embarrassed, but nevertheless, he sat down and he listened. And so that was kind of my first experience in lobbying. Over time, we had more meetings with Senator Gorton. We met with our representative, John Miller, both Republicans, and both took leadership roles over the years on some of our initiatives. Fast forward to the present, as Director of Advocacy, I have lobbied in DC. I go to, pre-pandemic, I would go to DC several times a year, and always try to involve the fellows as much as possible. Since they can't usually join me in DC, I have them joined by telephone on speakerphone to meetings with members of congressional staff, so that I see my job as mainly empowering citizens to do a good job being lobbyists themselves, and I'm there to back them up. So we always do some prep for the meetings, and so that they can take a key role in the meetings, and I can kind of come in and talk about the bigger picture. Team effort.
Thank you. Giovanni?
Yeah, for me, I had no experience with lobbying before in college. I mean, in high school and in college, I really wasn't involved with my right to, I guess, my voice to kind of use my voice with policies and all that stuff, which is kind of why I also really wanted to join the Fund for Global Health, because I knew I would learn a lot about how the entire process works, from how the government or how the president appoints kind of like funding, and how the senators and representatives in certain committees use that budget to budget their different programs that they have in mind. So when I joined the Fund for Global Health, I'm on my 6th month now. I joined in December. I've recently, since it's the pandemic, I've only been kind of talking to the Senator Durbin staffs through Zoom. But through those meetings, you can kind of see how your relationship with the staffers or with the senator, if you meet them, can affect the way they think about certain projects or like global health programs that you're talking to them about. So for us, for the Fund for Global Health, our main campaigns are with tuberculosis, with accountability, and with comprehensive primary healthcare. And we use kind of these meetings to talk to the staffers to push that agenda, and hopefully through those meetings, Senator Durbin and others and the other senators in other states in the SFOPS committee will increase funding for programs that we want to be increased. But as Keith said, I have not been to DC myself, especially during the pandemic, and that's probably a more effective way to lobby.
Thank you. You went kind of into the next question, an overview of Fund for Global Health, but I'd love to hear from both of you kind of more in depthly about what Fund for Global Health does and how it's organized and its framework.
So we're a nonpartisan, nonprofit aid and advocacy group. The aid part is some primary care work we do in Nigeria. The advocacy part is what Giovanni and I are involved in here. As he has said, we focus on the subcommittees that fund foreign aid. So there are 14 senators and 11 members of the House. We're recruiting fellows in those areas. We have about 40 advocacy fellows right now in many of those areas. We also work with a number of family physicians through the Global Health Interest Group in the American Academy of Family Physicians, and they've helped make a big difference, particularly on our primary healthcare ask. We pick issues where there's a need and where a small organization like ours could have some impact. And as Giovanni mentioned, we're working on increasing funding for tuberculosis, the top infectious killer of adults, at least aside from the pandemic. Primary health care in humanitarian situations, such as refugee situations and disaster, post-disaster situations. There's a shortfall in health in those situations we're trying to remedy. And finally, again, as Giovanni mentioned, having our U.S. Agency for International Development do a better job of reporting on what's actually accomplished. What are the health outcomes that are achieved with our aid? A key thing that I learned from results, and hopefully we're improving on here, is that people join an organization like this with good intentions, but it takes a strong and regular support for people to follow through. And also to, kind of coach and train people on the things that are effective. So we have twice a week calls with our group. Either I or one of our coaches works with the whole group. And as leaders emerge in our experience of the group, we ask them to become coaches often. So the bottom line is that all of this is built on a strong support network of both training and just consistent contact and support for taking these actions. Relationship with congressional staff is key. Giovanni I don't know if you're the point person right now with Senator Durbin's office. I believe you've done most of the communicating recently. And I'll stop there for now.
Yeah, that actually leads us to our next question very well, which is the different roles in each of the states. So I guess, Giovanni, you can talk for what you've been doing and what your role has been.
Yeah, for sure. So as Keith said, there are 14 senators that are in the SFOPS committee and 11 representatives.
And 1 second, can you tell us what the SFOPS committee is?
Yeah. So the SFOPS committee is the State and Foreign Operations subcommittees of appropriations. They, as Keith said, they are the subcommittees with the senators and representatives that kind of budget the foreign aid that is appropriated to foreign aid programs, like global health programs, many foreign aid programs, like Keith said, refugees and immigration, and global health programs. So Illinois, Senator Durbin, one of the senators in Illinois, is in that subcommittee. And since I'm in the Illinois team, I am in constant communication with Senator Durbin's staff, his staffers usually. And as Keith said, my team, our Illinois team right now is me and another fellow and our coach. So it's a team of 3. And we kind of share responsibilities with what they're reaching out to the staffers, reaching out to people, creating programming to kind of help other constituents in Illinois to use the power to talk to the senators, the staffers, and all that stuff. But other states have different sizes, as Keith said. Some states have bigger teams, like Maryland, I think, has one of the bigger teams. I'm not quite sure, Keith might know, while other states that don't have senators in the committee don't have a team at all. So yeah. Keith.
Yeah. I would just add that the work of the fellows kind of falls in 4 different areas: direct lobbying actions, outreach to find others to work with us, research to deepen our understanding of the issues, and particularly to answer questions that staffers raise with us, or the senators themselves would raise with us, and work with the media, such as letters to the editor and op-ed pieces. One of the major things that has been done in the last year that fellow teams have done in several places are putting on virtual town halls with their senators and in one case a representative. This is it's a project of a few months. You find a few other organizations that would like to host it with you. We do it on a general enough topic that would interest a number of people. Our topic was global health in the time of COVID-19. The teams would enroll a handful of co-hosts in several states, including the State Public Health Association. And then we would have anywhere from 15 minutes to an hour with a member of Congress. The 15-minute one was, well, I could explain that later. Anyway, these are great opportunities to talk to the senators and representatives directly. At University of North Carolina, the team there has actually put on 2 of these with their Congressman David Price. One was in person last February, and then a virtual one a year later, this past February. So 2020 and then 2021. We're to a point where the congressman now expects that we'll do this every year with him, so that's great. Develop that kind of relationship, and it really bumps up our relationship with the staffers to these people as well, because they're involved in prepping their boss for the meeting and much more responsive to us afterwards. So that's one of the best kinds of projects that the fellows are engaged in.
Okay, great. Question is, this is a bit like, personal to your own opinions and your own thoughts, but why do you personally see the importance in engaging in health policy as it relates to health equity?
Okay, I'll start with that. I just think this is a great way to make a difference. I mean, I think, since I know that we can do it, I think we have to do it. At least that's the way I feel about it. I mean, it's kind of there's good news and bad news in being in a democracy. One is the bad news is you're responsible for what your government does. And the good news is you can work with others to change it if you don't like it. So, I just think now that I know how to do it and I've experienced the difference that it makes, I don't feel like I really have a choice to quit. It's just, we just need to do it. It's so important.
Yeah, for me, as like Keith said, if you have the privilege to have the power to make a change, to use your voice to create that change, you should do it. And for me, one of my biggest privileges attending a top 10 university like Northwestern enabled me to learn more about the nuances and the social determinants of kind of health, and how health policy as a systemic issue discriminates and kind of negatively affects the health of many marginalized populations in America and in the world. And for me, not being able to use that voice, I only recently became a citizen in 2016. Actually, I got naturalized in 2016. So when I had kind of that power to vote and also use my voice to kind of enrich other people, like uplift other people, I did that in college through Globe Med, being able to educate other peers at Northwestern, and after college now through the Fund for Global Health, reaching out to other constituents in Illinois and other people in general about what's happening right now in the world, how global health programs are being funded or underfunded, and how they can use their voice to reach out to the senators that are kind of in charge of that budgeting to make a change. And hopefully through that change from the top, the systemic changes, it can trickle down and help us build a more sustainable healthcare and a more equitable healthcare in the future. And that's kind of why I joined the Fund for Global Health. And I believe that, as Keith said, that as a citizen in America, it's a powerful thing to have. You're using your voice. Obviously, some people don't find that powerful, but we, as a group, when we support each other and kind of uplift each other and help each other kind of be educated enough to learn more about how we can address these social inequities, health inequities. Hopefully in the future, we can find a world where everyone can thrive healthily.
Thank you. We've kind of danced around it. Both of you have talked about what you do at Fund for Global Health, but I'd like to take this time for you guys to really identify and define what lobbying is and what it does and its goal.
Yeah, I think lobbying is any action you take that's designed to influence a member of Congress's action. And I'd like to call it citizen lobbying because lobbying in general tends to have a stigma attached to, powerful, wealthy people and professional lobbyists sort of have a bad name, kind of a stigma. But to me, citizen lobbying is a different animal. It's, you know, people like us doing the lobbying, educating ourselves, learning what to do, and then staying with it. So citizen lobbying is that is people learning the issues, learning what to do, working with others to make it happen, and sticking with it.
Thank you. I have a follow-up question. Oh, sorry.
No, go ahead. I was just going to say, I totally agree with that. Before, again, looking into the Fund for Global Health, I had the stigma that lobbying was just big corporations or people with money kind of influencing what senators did or what representatives did. But citizen lobbying is a totally different type of thing, as Keith said.
Yeah. So I was just going to ask, you know, how does citizen lobbying, how is it more appealing and how is it less like elitist, and how do you guys break that stigma?
I don't know. I actually don't even think about the stigma as part of what we do. Nobody is. The only time I think about that is when I'm telling people in other settings what I do, and if I say I'm a global health lobbyist, I have to worry about what they might think. But anyway, I'm not too worried about the stigma. What was the other part of your question?
How do you make citizen lobbying more accessible and equitable, basically?
Yeah, I think that's really hard, especially right now in the pandemic. Obviously, citizen lobbying involves the community and like people at the core and building solidarity with other people in your community. Obviously, with the pandemic in the past year, it's been hard to get out and interact with people. So there's a lot of issues such as like having internet or having access to Wi-Fi, having a laptop at home, to even be able to have access to other people outside your community. So I guess it's hard to lobby for to address social kind of inequities and health inequities when the systems itself kind of prevent you from having kind of just the basic access to the needs that you need to have to lobby. But yeah, that's just another thing. I guess I don't have all the answers for that. But again, since I have the privilege and that I have now, it's obviously an important thing for me to be able to reach out to other people, other constituents in Illinois, especially in underserved areas in the state, to help them get educated and kind of help them use their voice, which can be as simple as just writing a letter and emailing the senator's office, right? So yeah.
Yeah, that was perfect because you led us right into our next question, which is like, how do you suggest that young people get involved in policy change and advocacy?
Yes, it's difficult to make a difference all by yourself. So you need to find a group that is doing something that you like. And there are lots of groups out there. I think it's important to find one that is devoted to actually empowering citizens to take action. There are a lot of lobby organizations in DC where they might be doing very worthy things, but they're primarily based around professionals in the DC office doing the work. The Congressional Management Foundation, which has studied communication between elected officials and constituents for many years, says that they've surveyed congressional staff and they say that personal messages from constituents are one of the most powerful influences on a member of Congress's decisions. And I think a lot of organizations are not taking advantage of that. And there's a lot of people out here that want to make a difference. So finding a group that is doing something you like, but also a group that has a structure for supporting the citizens to learn the issues, follow through on actions, and training and supporting over time. I've mentioned a couple. Fund for Global Health is one. Results is a great one as well, and there are others out there. So that's
and the Fund for Global Health is a great one as well. We're actively recruiting. if you would, if I know Sarah has kind of shared our flyers for if a lot of people there are interested, if you are interested in joining a state that has a member of an SFOPS subcommittee. Illinois, I know we're a small team, so we would love to have anyone that is interested in joining as well. But if not, we are actually hosting a letter writing workshop in 2 weeks, in June 3rd on a Thursday. And that's kind of a way for you, if you haven't done lobbying before, to kind of learn how to write a letter, who to send your letter to, what does your letter have to include or consist of to be kind of powerful or impactful. And so that is a good way for a lot of people to kind of start lobbying. But as Keith said, it's really hard to make a change as an individual. So again, there are many nonprofits and other groups out there that you could join too.
Okay. Do you have to be a constituent of the state to be able to lobby for that?
It helps. It helps. You have to at least live in the state. We do take people who are in the state to go to school, and they're there for a number of years. We do train them as constituents to participate in lobbying.
Okay.
Yeah, and I myself, I'm from Kansas. However, I lived in Illinois for 4 years, and then in my junior year, I actually changed my residency to Illinois. But I know there's someone in the Vermont team in the Fund for Global Health who is from New Jersey and is a New Jersey resident, but goes to University of Vermont and therefore is a constituent and lobbying for the Vermont team. So yeah, it doesn't necessarily have to be your home state or your home residency.
Hey, thank you. So our last question is basically just time for you both to share examples and stories of the work that you have empowered young people to do or you yourself have done.
Sure. Actually, I'll talk about what's going on in Oregon. Sierra is here from Oregon. Yeah, Sierra started with us, maybe a couple years ago. And it started out it was very hard to get responses from the staffer, Senator Merkley's staffer. So it was very frustrating for many months, but she kept at it, and we built up the team, and she could probably tell you herself here. But over time, they had a virtual town hall with Senator Merkley. Last year, Senator Merkley put forward a major ask of ours and is now our lead champion on the Democrat side for primary health care and humanitarian situations. We just talked to his staffer today, and he's continuing to move forward for the next appropriation cycle. So it was I'll say a long, hard journey. At least the first part was hard, and now it's definitely paying off.
Yeah, for me, I'm very new to lobbying and the Fund for Global Health in general. But from what I've heard from Keith's stories and other members of the Fund for Global Health, from my coach, Sierra is actually one of the Illinois team's coach. She's done great research that I've read upon on lobbying and all that stuff. And it's definitely encouraging about how I can change, or how I can, again, use my voice to make a change.
Thank you both. That was really comprehensive and I've learned a lot. If anyone has any questions, you can put them in the chat. I have like a couple more questions, but if anyone has any questions, you can put them in the chat.
Yeah, I'm actually gonna put a few of the flyers again. I know Sarah already put some of the flyers in the calendar for the GlobeMed calendar. But again, we have our upcoming letter writing workshop in 2 weeks. And if you would like to learn more about how you can write a letter to the senator's office, this would be a good way to learn that. So I will put that in the chat. I think I can do that.
Yes, we can also put it in like a follow-up email for registrants.
Oh yeah, that'd be great.
Have people watching on YouTube. Okay, so we have a question in the chat. In your experience, what kind of critical mass in terms of lobbying is needed to sway a representative who is not on board with your issues to take action, change a vote, joint efforts, i.e. via number of calls, letters, emails, visits, etc.?
Boy, that varies so much.
I guess you can start off by explaining, what critical mass is, just for people watching after.
Well, critical mass is sufficient mass to make something happen, to push something over the line. It's partly numbers. It's partly persistence of a few people. It's partly finding some people of influence if you can. So that's where our doctor friends in the American Academy of Family Physicians are helpful. So I don't think in terms of critical mass. I think in terms of in those terms, like let's make a great case. Let's stay with it. Let's find influential people who can help us make that case. And so, yeah, again, in Oregon, we have our fellow team. We have the director of global programs for an NGO that does medical care in humanitarian situations. They have met with Senator Merkley. It's part of the process of influencing him to take a lead on this. I guess that's my answer.
Yeah, I mean, Keith definitely has more of experience in this. But for me, just the senator's office, their staffers, the senator themselves, they're really busy. Sometimes it takes a lot of emails and a lot of phone calls for them to even respond to like a request to meet with them. But you just have to have that persistence, I guess, and keep emailing them and following up with your emails. Yeah. So.
Great, thank you. If anyone, two more questions, I believe. Okay, never mind, one more question. What's your big challenge when it comes to lobbying citizens? Or I guess.
Do you mean lobbying citizens or citizen lobbying? What do you mean exactly there?
We'll see if they clarify.
Okay.
Maybe getting people to lobby or join us.
I guess you guys can answer it from both perspectives, getting citizens involved and citizens lobbying, like citizen lobbying.
Yeah. Yeah. I mean, I like, as Patrick said, it's definitely, I think for me, it's definitely getting like swaying the representative, or even just the fact that it's really hard to get their attention to meet with them. That's probably like the biggest challenge that I've encountered in the last few months that I've been working with the Fund for Global Health. Keith probably has a more challenging issue that he's encountered.
I kind of go back to what got me interested in the first place in terms of motivating people. I mean, you want to say that what we're doing is important. You want to convey the importance of the issue, the chance to save lives, and not just to save lives, but to use the power of government, which is huge, as a lever to save as many lives as you can. So to convince people of the importance of and the value of what they're doing, and then to let them know that they can do it, that they could be the one to do it. It's not up to the experts or the DC people or whatever. It's up to us. So I think that it's a combination of this is such an important issue, and you can be the one to do it, working with others.
Giovanni, I'd love to hear how your GlobeMed experience applies to your lobbying experience now, and if there's anything that you've grasped through your GlobeMed experience in undergrad that you're using right now.
For sure. Well, the biggest thing, I was the director of campaigns for the last 2 years and I was I'm a campaigns member for the entirety of my GlobeMed career. So as a campaigns member, we are kind of in charge of organizing and planning and executing fundraising ideas, or how to reach out to other people in the community and how to educate other people in the community about our partner. And at Northwestern, our partner is Adonai, which is in Namagaga, Uganda. So kind of learning how to be proactive to reaching out to companies nearby that we can ask for their support for our fundraising, or reaching out to other people of like higher influence that will help us earn more money to provide to our partner organization. I've kind of used that skill of just how to be formally communicating or keeping in touch with other people. As I email Senate Urban staffers, and as I realize that they're busy and they won't respond, knowing kind of what the next step to take is, whether you should call them, whether you should email another staffer in the office, or whether you just wait. I think patience is really a big thing that I've used, and I've learned from my experience in GlobeMed, and I've taken and used that in my role now in the Fund for Global Health. And also just the fact that I learned a lot about health inequities and social justice education in GlobeMed, in my 4 years in GlobeMed, thanks to the GHU team and also just GlobeMed in general. Learning those terms and being able to explain it to other people who may not know exactly what is happening in terms of health inequities in America, in their communities and in the world, being able to connect with them and educate them on those issues is something that I've definitely taken with me from GlobeMed to my role now in the Fund for Global Health.
It's wonderful. If there's no other questions, I have one last question before we round up. And I just like, it's not really a question. I just like you guys to walk us through a typical lobbying call. So I don't know if we want to like make up an example of like an issue. I guess COVID-19 is definitely a very pressing issue. So maybe vaccine equity. So walk us through like the preparation, some questions that you guys normally ask, and how you follow up.
Yeah, I mean, a lot is done for sure in the preparation. My team, small team of 3, usually weeks before, we like to plan the kind of our laser talks, or very short, like 30-second to a minute campaign, like talks, elevator pitches that you would say to the staffer about what the problem is, why it is a problem, and what we can do to address that problem. So that's kind of done like weeks before. Given that the staffer or the senator has agreed to meet upon a certain date. And then during the meeting, obviously they're busy, you usually only have 30 minutes in a Zoom meeting. So you kind of have to introduce yourself and quickly pitch your pitches. And for us, for the Fund for Global Health, that would be like tuberculosis, primary healthcare and humanitarian situations, and accountability for global health programs around the world. So my team and I would kind of share the responsibilities of creating a 30-second, a minute pitch, laser talk about those campaigns. And hopefully after those campaigns, the staffer, the senator has questions about what we want for them to change or do. And then obviously afterwards, keeping in touch, following up with them, making sure that they're sticking true to their word about championing a certain campaign, which is harder than it is. Yeah, he probably has more.
That's a pretty complete picture, Giovanni. Thanks. I would just add that developing a dialogue with a trusted relationship with the staffer is key. So it's not just us talking at them. It's as presenting our issue, making our case briefly, and then finding out what they think, getting their feedback, even getting their advice on the best way to go forward on a particular measure. Our goal is to develop a long-term relationship with a staffer where we become kind of a trusted resource on the issues that we're talking about. And we can often do that by, sometimes it's a good thing that they ask a question that you can't answer, because then you can say, well, I'll look into that, we'll get back to you. And then you do that and become more of a trusted resource for them and more likely to talk to you in the future. So, yeah.
Thank you. Well, on that note, I'd just like to end with you guys giving something for us young people to leave with. Just what's your biggest piece of advice to young people that are looking looking to step up, looking to maybe start lobbying or forming some sort of interaction with their members of Congress?
Find a group you like and get involved. And again, particularly one that is empowering citizens to make policy change.
Yeah, I mean, yeah, sorry, Keith, go ahead.
No, go ahead.
I definitely just want to say that it definitely is at the core of everything, at the core of healthcare and healthcare kind of healthcare medicine in general is the people. And for me, the communities that I've built and the communities that I kind of build myself around is the reason why I'm resilient. And I think I use that resiliency that I've gained from my community. And without community, there is no resilience, I think. And with that resilience from the community, we can help each other kind of address these healthcare inequities that we see.
Thank you. I love that. So thank you to everyone for showing up tonight. And thank you especially to Giovanni and Keith for answering so many of our questions. GlobeMed is grateful to have these free opportunities to learn and advance our common goal of bettering health outcomes for all. We're only able to do this through kind donations made by others. So if you're looking to support future programming such as this, take a look at the links in the chat. If you know anyone that you'd like to see us feature, then please let me know, and also be on the lookout for the email that will give information on how to register for upcoming events, as well as the YouTube streaming link. So thank you again, Keith and Giovanni.
Thank you all for having us. Yeah. Have a good evening, y'all.
You too. Bye.
Bye.